Ever notice how something can feel like a totally modern issue? Something we're grappling with for the first time, but then you dig a little deeper and bam, it's got roots going way back.
Yeah, you're right. It's like we're constantly rediscovering the same struggles, just dressed up in different clothes for a new era.
Exactly. And that's precisely what struck me about borderline personality disorder, BPD, when I started digging into psychologist Alexander Kriss's book, Borderline.
Oh, interesting. What's his take?
Well, he doesn't just focus on, the diagnosis as we know it today.
Yeah.
He kind of takes this deep dive into its echoes throughout history. It's wild.
I can see why that would be so captivating. I mean, we often forget that these labels, these diagnoses, they're relatively new, but the underlying experiences, the suffering, that's been around forever.
Totally. And Chris starts by going all the way back to ancient Greece, which I thought was fascinating.
Okay, wow. Ancient Greece. So what, like Hippocrates and all that?
Yeah. Imagine, right, you're struggling with these intense emotions, feeling totally out of control, and you go to, the wisest healer in the land, and they're like, yes, it's the wandering womb.
Can you imagine? Talk about a misunderstanding. But I guess it shows just how long we've been trying to make sense of mental illness, even when we were totally off base.
Right, but what I find interesting is, even back then, there was this acknowledgement that our mental and physical states are connected, even if they totally misinterpreted it.
Yeah, I see what you mean. It's this idea that our bodies and minds aren't separate, which we're starting to understand more and more today. But you're right, the interpretation was a bit off.
A bit off, for sure.
Yeah.
But Chris points out this human tendency to want to categorize and label, even when those labels oversimplify things. And that urge, especially when it's aimed at women's behavior, can get really dicey.
Oh, absolutely. And historically, that urge to categorize women's behavior has had some pretty devastating consequences.
Totally. Chris even connects this back to the Salem witch hunts.
The Salem witch hunts. Wow, okay, that's a pretty intense connection.
Yeah. He suggests that at least some of the women accused of witchcraft might have actually been dealing with, mental health issues we recognize today. Which is kind of a chilling thought, right?
It really is. It makes you think about how societal fear and this lack of understanding about mental health can have these, truly tragic consequences.
And the whole history of hysteria as a diagnosis is another example, right?
Oh, absolutely. Hysteria, the classic example of pathologizing what we don't understand, especially when it comes to women and their experiences.
And even though hysteria isn't a valid diagnosis anymore, it makes you wonder, did we really get any better at understanding mental illness? Or did we just find new labels, new ways to categorize and control what we find threatening or confusing?
It's a great question, and it's something Kriss grapples with in the book. He even talks about Freud and the impact of psychoanalysis, which was revolutionary in many ways. But even Freud struggled with issues of trauma, particularly in women. He opened up these new ways of thinking about the mind, but as Kriss points out, he brought his own baggage to it, his own biases, which influenced how those ideas developed.
So we're already starting to see how social and cultural factors, along with our evolving understanding of the mind, has shaped how we view and diagnose mental illness.
Precisely, and that historical context is so important because it helps us understand not just the evolution of the BPD diagnosis itself, but also the stigma surrounding it, which, as Kriss argues, continues to impact individuals even today.
And this is where borderline goes from a history lesson to something much more personal,
Yeah, it's like the book takes a turn inward.
Exactly.
Yeah.
Because Chris brings us right inside his therapy room. He shares his experiences not just as someone who, studies and writes about BPD, but as a therapist who actually treats patients with the disorder.
Right, and that's what makes this book so unique. He's willing to be both the expert and the, well, I don't want to say patient, but someone who understands those experiences firsthand.
Yeah, exactly. And he does this by introducing us to two of his patients, Anna and Haku. Their stories are so powerful, they really give you this window into what it's like to live with BPD day to day.
Anna's story in particular really stayed with me. Kriss portrays her with such honesty and rawness. She's young, grappling with these intense emotions, and she's carrying a lot of past trauma. But beneath it all, you can feel this deep desire to understand herself, to heal.
Totally. And her therapy journey, it's messy. It's not this straight line to recovery. She pushes back against Kriss, questions him, even tries to push him away at times.
Right, and I think that's something a lot of therapists shy away from showing, that push and pull, that tension that can exist in the therapeutic relationship, especially with BPD.
Absolutely. But what I find so refreshing is that Kriss, he owns that tension. He's honest about the fact that he also struggles with BPD and how that influences his approach to therapy, even his interactions with Anna.
It's like he's saying, hey, I'm not this objective observer here. I'm in this with you, bringing my own experiences to the table.
Exactly. And it made me wonder, does that kind of vulnerability actually make him a more effective therapist? Does it build trust, even when things get messy?
It's definitely possible, and it makes me think about this concept Kriss talks about, transference. It's this idea that in therapy, a patient might unconsciously start to direct feelings from past relationships, especially difficult ones, onto the therapist.
Okay, so how does that play out with Anna?
Well, you see her testing Kriss, pushing his boundaries, questioning his motives. That could be seen as a form of transference, right? Like she's bringing her past experiences of vulnerability and hurt into the therapy room.
And because Kriss has his own experience with BPD, he's more aware of that dynamic, more sensitive to it maybe.
Yeah, potentially. He can't just approach it from a purely clinical perspective. He has to navigate it on a personal level too. Which brings us to Haku, the other patient Kriss focuses on.
Right. Haku, who's a whole different story. I mean, here's a college student who's basically withdrawn from the world, finds comfort in this tiny space under his bed.
It's almost like he's created this little world where he feels safe, in control.
Exactly. And I think Haku's story really challenges us to think about what it means to truly help someone, especially when their idea of help looks very different from what we expect.
Absolutely. Haku's resistant to traditional therapy. He prefers the confines of his own world. And that forces Kriss to get creative, to think outside the box.
And this is where Kriss's emphasis on empathy, on really trying to understand the world from the patient's perspective, shines through, right?
Definitely. He talks about how important it is to look beyond the behavior, to try to understand the pain, the fear that might be driving it, especially with BPD. And sometimes that means meeting the patient where they are, literally, even if it's under a bed.
It's like he's saying, okay, I see you, I hear you, and I'm not going to force you into a box that doesn't fit.
Exactly. And I think that's a powerful message, not just for therapists, but for anyone who wants to understand BPD. It's about recognizing the humanity beneath the diagnosis.
So we've gone from ancient Greece to under a bed. We've talked history, therapy, personal experiences, but how does it all fit together? What about BPD today?
Well, that's where Kriss starts to unpack the whole DSM thing, the Diagnostic and Statistical Manual of Mental Disorders.
Ah, the DSM,
Aha.
the book that holds the keys to the mental health kingdom. Or at least that's how it sometimes feels.
Right. And Kriss, he has some thoughts about that. He's not saying it's useless, but he points out that this whole checklist approach, it can be limiting.
Yeah, like trying to stuff a whole galaxy of experience into a couple of bullet points.
Exactly. You lose the nuance, the individuality. And Kriss argues that this oversimplification, it can be especially problematic with BPD because for many people, it's rooted in this really deep, complex trauma.
And this is where I think that idea of complex trauma comes in, right? Like, Kriss seems to be pushing for a wider understanding of what trauma actually is, what it can look like.
Totally. He's saying we need to move beyond these single, easily definable traumatic events. Because with BPD, it often comes from these more ongoing, sometimes subtle, but no less damaging experiences, especially during childhood.
So it's like we're talking chronic emotional neglect, witnessing violence, that kind of thing.
Exactly. These might not fit the classic big T trauma definition, but they can have a huge impact on someone's sense of self, their ability to form secure attachments, the whole shebang.
Makes sense. And it makes me think about how we treat BPD. Kriss talks about DBT, dialectical behavior therapy, which has become like the go-to for a lot of therapists. What's his take on that?
He sees the value, definitely. The way DBT focuses on emotional regulation, coping skills, that's huge for a lot of people. But, and I think this is important, he's also cautious about seeing it as some kind of cure-all.
Right, like one size fits all.
Exactly. He's all about individualized treatment, recognizing that, hey, what works for one person with BPD might not work for another, and that's okay.
So where do we go from here? How do we move towards a more, humane approach to BPD? An approach that acknowledges the person, not just the diagnosis.
Well, Kriss would say it starts with challenging the stigma, head on. This isn't a character flaw, it's a response to pain, often very profound pain. And we need more empathy, more understanding, both from the public and, honestly, within the mental health field itself.
And maybe that's the biggest takeaway for me from Borderline. That quote from Anna, one of his patients, where she asks, what if BPD isn't just an illness, but a different way of experiencing the world, one that's often painful, but also holds unique insights? That really got me thinking.
It's such a powerful question, right? Because it forces us to reframe how we think about BPD. It's not just about deficits, it's about differences. And maybe, just maybe, those differences, those unique insights, they have something to teach us.
It's about recognizing the humanity beneath the label, right?
Absolutely. It's about seeing the strength, the resilience, the pain, and yeah, the full potential of each individual. Because they're not just a diagnosis, they're a person.
This deep dive into borderline has been eye-opening, to say the least. Thanks for taking this journey with me. It's a conversation I think we all need to be having.
Absolutely. And it's a conversation that hopefully leads to more understanding, more compassion, and ultimately a better experience for those whose lives are touched by BPD.